listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on today's episode of Simple Health Radio. Today's question comes to us from Terel Jackson, who is the host of Health Science for the Rest of Us podcast. This is a very interesting podcast, and they talk about a lot of the common health topics in different ways. I highly recommend you take a listen to some of their recent episodes. Terel sent in a question about burns, so let's have a listen.
Hi, Dr. Emron. This is Terel of the Health Science for the Rest of Us podcast. It's a show where we take a super practical look at the body and its shenanigans and the world of fascinating ways we try and keep it healthy. Some of our top episodes are on stool samples and body odor and ambulance rides and health voting. So if anyone is interested in checking us out, they can find us at healthscienceforeveryone.com or wherever they listen to podcasts. In the meantime, I have a question for you. The question is it true that you can treat burns with butter? Thanks so much for all that you do, including taking my wacky question.
First, let me thank Terel for taking the time to record a great question about burns. When I see people in the ER or the urgent care and they've suffered a burn, I actually have to identify several different factors immediately before I can begin treatment. So the first thing I need to know is what caused the burn. For example, was it from touching a hot object like a stove? Was it a chemical burn like from a battery or a radiator? Was it a sunburn from being outside too long? Is it a scalding burn where hot water spilled everywhere in the kitchen? Or was it an explosion? So the first thing I need to know is what caused the burn before I can actually start treating it. The second thing I need to know is exactly what part of the body was affected. So it makes a difference if it was a hand, or the face, or the neck, or even a joint. And then we have to actually measure the burn size, the length and the width, in centimeters. And this is so that we can calculate accurately something called the total body surface area. So the total body surface area is a measurement that we need to know to identify exactly how much of the body was affected. Now, medically speaking, we use a rule of nines. So what that means is we can divide the body into different segments based on percentages of 9. For example, each arm is about 9% of the total body surface area. The abdominal area would be about 18% of the total body surface area, and each leg is about 18%. So, for example, if we had somebody who had a scald burn in the kitchen or maybe an explosion, and it affected both arms and a large part of their abdominal area, I can already estimate it's about 9% for each arm and then about 18% for the abdominal area. So we've already exceeded about 40% of the total body surface area. That affects the treatment for complex burns. The skin is a barrier. So we need to remember that the skin is in place to keep our inside parts separate from the outside world. And so when large percentages of the skin are affected, that means the outside world is actually going to get inside the body, and that's going to set up complications. So once we identified the history from the patient about what happened, we've measured the anatomical area, then we talk about the depth. So the depth is where we assign the severity of the burn. So whether it's a first degree, second degree, third degree, or fourth degree. And this is something that it can be very confusing because you can have a burn, for example, that affects over half the body, but it doesn't go very deeply. So it's actually a first degree burn, but it covers a large area of the total body surface area. So the most common type of a first degree burn is a sunburn. So a sunburn affects only the epidermis, which is the outermost layer of skin. Technically, it's all dead skin, so that's why we consider it a first degree burn. After a few days, people who've had a sunburn, they'll describe the skin to peel and it'll go away, and then there's no scar tissue that develops underneath it, because it never went deeper than just the outermost layer. So a first-degree burn, the most common type, is a sunburn. Now, a second-degree burn goes through the epidermis and touches the dermis, also called the dermal layer. So in this area, you're going to have a large number of nerve endings. So for example, if you touch a hot stove with your fingers, it's going to blister and it's going to become a second-degree burn. Even though it's only affected the fingertips, that's about 1% of the total body surface area. But it could be a very severe burn because it's a second-degree burn based on depth. Now, a third-degree or a fourth-degree burn goes deeper and deeper into the body. So these burns go through the muscle and sometimes even to the bone. With a fourth-degree burn, you're going to have charred flesh. These people oftentimes need to be hospitalized. Perhaps they were in a house fire or maybe a car accident where something exploded. So the flames overwhelmed the body, and those people are going to be having serious complications. Oftentimes they require surgery. They may need amputations, but they oftentimes need careful monitoring in the intensive care unit. So these are people that you can't just send home. You have to monitor them for all the complications that we talked about and some of the new ones that we're going to mention in just a minute. So now that we've talked about the classification of burns, we can answer the question that was sent in by Terel. Can you treat burns with butter? And that answer is no. I did research this. I went through several medical journals. I went through some of our textbooks, and I looked at some information about burns. And it's true that in the past, people have tried using butter as a burn ointment. But with all the research that's been done, the burn that is treated with butter actually has worse complications. So the people described more pain, there was a higher risk of infection, and there was no benefit at all to healing. So the short answer for using butter on burns is don't do it. It's not going to help whether it's a first degree, second degree, or a third degree burn. Just avoid that. Now, what things have been studied and proven to help?
Hey everybody, this is Ricky, the Jolly Rancher Commander from Geeked Up Radio, where we discuss comic book movies, video games, and the cringiest news we can find on the internet. Find Geeked Up Radio on iTunes, Google Play, Spotify, or most anywhere you get your podcast from.
So the first thing is actually just cool water, especially tap water. You don't want to use ice water or freezing cold water. Just cool water from the tap is sufficient. What you want to do is run the water over the burn site. If it's a superficial burn or even a sunburn, it's going to help because after about 10 or 15 minutes, it'll actually calm down some of the inflammation. And this also helps to cleanse the wound. So if you use a very mild soap with water, you're going to remove some of the surface bacteria, and that'll reduce your risk of infection. The second treatment option that works are just cool compresses. For example, if you have a towel under cool water, you can apply that to the burn site as a wet dressing. And if you do that for 5 or 10 minutes a couple of times a day, that's actually as effective as using other ointments. Now, people do use antibiotic ointments, things like Neosporin or bacitracin, and you can apply that to a burn with a very light dressing. So you can keep it covered to prevent infection, but you don't want anything too tight. If you apply very tight dressing, it causes some skin breakdown, and that doesn't help the burn to heal properly. You actually have to let burns breathe. You do need some open air on them from time to time. Now, aloe vera has been studied, and that has been shown to help. So a small amount of aloe on a first or second degree burn is actually anti-inflammatory, and it helps to promote blood circulation. So aloe vera is recommended. One of the newer treatments that's being used in wound care centers is actually a very ancient treatment. So this is called honey. So many burn centers now use honey as a topical antibacterial agent, and it's actually antifungal as well. Now, I don't recommend that you put honey on burns at home until you've spoken to a doctor or talked to them in detail because you may not be using it properly. So don't use it at home until you see a doctor about that. But if you read about it enough, you will find that honey is having a large amount of research behind it to support its use in more and more patients, especially burn victims. Now, the other questions that we often get are regarding scarring. And scarring is cosmetically very disfiguring, but it can also cause pain. And so people who develop pain associated with burns, it's all because of the nerves that are now exposed. So again, we talked about first-degree burns are very superficial. Within a few days or a week, that's going to heal. There's not going to be any long-term complications. But with second and third-degree burns, you're going to have pain, swelling, and oftentimes blister formation as well. So the blister fluid is actually healthy. It's a sterile fluid. There's no infection in the blister fluid itself. What you don't want to do is open it up prematurely. So if you poke at it with your fingernail or you use a needle to puncture it, you've created an opportunity for bacteria to sneak in, and now they're going to fester inside of that blister area. So this can lead to a boil or an abscess or cellulitis, and this is going to be the complication that we're trying to prevent. So don't pop blisters. If there is a blister, leave it alone. Do the warm compresses like we talked about above, which is cool compresses, and do cool water as necessary. You can use soap and water in the shower, but very gently. If the blister opens up on its own, that's great. That means the body was prepared for it to heal. But if you prematurely open it up, it's going to cause complications. The blisters actually protect the burn, and it allows the new skin to grow underneath, which is the dermal layer. So the longer the blister stays on top, the healthier that burn actually becomes. Now, the risk of scarring also goes down as long as there's a covering, so that body's own blistering, or that layer of skin, actually reduces scar formation. Now, there are a couple of things that you do need to keep in mind. So people who've had a burn, whether it's a 2nd degree, 3rd degree burn, and they go out in the sunlight actually preferentially absorbs into the wound itself. So this means people who've had a burn, if they go outside in the midday sun, the scar that forms is going to be darker than the surrounding area. It's almost like an absorbing type of material, a sponge. The problem is if you have fair skin and you have a burn and you go outdoors, that area of skin is going to be permanently darker than the surrounding tissue. So you actually need to avoid the direct sun whenever possible after a burn. You need to wear long sleeves or long pants, and you do need to use some type of sunscreen to protect a burn. And that may not be obvious, but that's actually necessary. Now, the second thing is that you need to update your tetanus vaccination. So tetanus is a bacteria. It lives in dirt, it lives on metal, and it lives outdoors. So if you've had any type of a wound due to a burn that occurred outdoors, you have a risk of contracting tetanus. Now, most people get their tetanus boosters periodically. Most people get them either freshman or sophomore year of high school, and then about every 5 or 10 years after that. Many people update it when they travel. So if they're going to Mexico or Europe, or they start a new job, or they work in healthcare, they're usually going to be on top of it. They're going to get that updated. But if you don't remember when your last tetanus booster was, you may want to think about getting one today, but definitely get a tetanus booster after a burn. Because again, tetanus is a bacteria that contaminates wounds, and people who develop tetanus can actually die. So we take that very seriously. It is a preventable infection as long as you get your tetanus booster. Now, there's some complications you could keep in mind. If there's oozing from the burn site, smell, if there's fever, if the skin edges don't look right, even when they're healing, then definitely you need to see a doctor. Whether your doctor or an urgent care or an ER, take a photograph of it, discuss it with them. They're probably going to put you on a prescription antibiotic and some other dressings, and they may also refer you to a wound care center. There are many specialized burn care centers across the country, and they do amazing work. Some of the burns that become infected or they have complications require grafting. So grafting involves taking healthy skin from a different part of the body and actually stitching it onto the burn site. So grafting of skin is a cosmetically appealing way to manage very bad burns, especially in areas that are cosmetically sensitive, places like the face or the top of the hand or the neck. So it's important to get connected with the right specialist as soon as possible. Now, I do have links on our website, simplehealthradio.com, and you can learn more about different types of burns, including 1st degree, 2nd degree, 3rd degree, and 4th degree burns. There's some links to other associations and information about home remedies that may be effective for you. So again, I want to thank Terel from the Health Science for the Rest of Us podcast. You can visit their website, www.healthscienceforeveryone.com. They are very active on social media, and they have a lot of great information about medical topics. If you have a question that you would like me to answer, just record it on your phone or your computer and send it to us via email. You can connect with us online. We are on all the major social media platforms. You can also listen to this episode and all previous episodes on Spotify. I hope to have you back on a future episode.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Amron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.